yesterday was not quite right, but we think we have that resolved, and we're checking on that. So I'm getting the thumbs up saying it's okay to go, that the sound is fixed today. So thank you for your patience on that. I'm Randy Murphy, epidemiologist and director of disease surveillance for the Mobile County Health Department. We're coming to you live from our downtown Keeler location, here to give you the update of how the COVID-19 pandemic is infecting Mobile County. We always start with some numbers. Today will be no different. It's pretty shocking that worldwide we're nearing 6 million cases of COVID. In the U.S., around 1.7 million cases, and over 100,000 Americans have died with COVID-19 disease. In Alabama, we're sitting just over 16,000 cases, 1,755 of those hospitalized, with 590 deaths. And just to remind you that alabamapublichealth.gov dashboard is updating only once daily now, mid-morning. For Mobile County residents, our report today describes 2,109 residents with COVID-19 disease, with 229 of those, or 11%, hospitalized, and 112, or 5.3%, who have died from COVID. Our age distribution, sex, and race distributions have been changing very little as we have added more and more test results and investigations. Early on they jumped around quite a bit, but now they seem to be fairly stable. We're seeing COVID-19 disease in all age groups, but predominantly in those over the age of 25, with about half of our cases occurring in people 50 and over. See, again, 15.6% are healthcare workers. That 15% has been fairly stable. About 15% are residents of long-term care facilities, and 8% employees of long-term care facilities. So again, around 23-24% of our cases are related to the outbreaks that are ongoing in long-term care facilities. On Tuesday, the first business day of this week after following the holiday, I reported on a new stat that we will be providing weekly, and that was on the number and percent presumed recovered. On Tuesday, when I made that calculation, it was 53% of the cases, just over, I think it was around 1,100, who were presumed recovered based on a definition put forth by the Alabama Department of Public Health. So we will update that number again on Monday, along with adding some additional charts in the report that were requested by Unified Command to show the trend in the number of hospitalizations over time and the number of deaths over time. Those things, look for those things in the report on Monday. We're still reporting on COVID patients with severe outcomes of hospitalization and death, and 90% of those that are hospitalized with COVID disease are over the age of 50, and we have very few, we have one person in the 5 to 24 age category who was hospitalized. That was pretty early in our outbreak, someone who had underlying conditions, because remember, people of any age who have underlying conditions are at great risk of hospitalization and death, severe complications of COVID-19 disease. I keep reminding my 35-year-old niece, or cousin rather, who has type 1 diabetes and has since she was 5 years old, that she is at great risk of severe complication because of her diabetes, even though she's quite young. Among those that have died, 99% of them are 50 and over, with 80% 65 and over. And again, that's I just saw a typo in our daily report right there. See how that happens, folks? We'll get that corrected before tomorrow. Of the people who died, it's an even split with sex, half of them female and half of them male. So some of the other hospitalization information, so those that we know have been hospitalized, around 37% of them required intensive care, and 21% have required mechanical ventilation. I've said earlier, I think in this forum, that the remdesivir that the Department of Health and Human Services shipped to all of the states and now has gone to all of the hospitals. This is a treatment that is proven helpful for people who are sick enough to be in an ICU. It's not used for other people right now, but for some patients that are hospitalized with COVID in the ICU, this treatment is proving to be quite helpful in preventing the severest outcomes and deaths. So we are really thankful for that, and our hospital association and our area hospitals are working to try to find, continual supplies of that treatment, so that when the vials that have been donated by the federal government run out, they will be able to continue to provide that therapy to the sickest patients with COVID disease. And again, remember that everyone who has died has either died in a hospital or in a long-term care facility, and more than half of the deaths in Mobile residents are associated with previously being in a long-term care facility. I want to make sure to point out something that maybe was misstated on the 6 o'clock news last night on at least one station. So this chart showing the number of cases by week, this last bar is always going to be short because this week is still ongoing, right? This does not mean that we have COVID going down. This means that this is the current week, and we still have several days of counting to do for the current week. So the trend is still increasing, and this last bar, I'm probably going to remove it next week so this mistake cannot be made again. But this does not mean that COVID is going down. It means that we are so far only counting cases that have been reported Sunday, Monday, Tuesday, and Wednesday, right? So please try to correct that in the media if you reported that wrong last night. All right, let's talk about some other information that is new from CDC. So there are new resources. There are so much coming out. It's so hard to keep up. And I just wanted to make you aware of some additional resources just in general that you can find on the CDC website if you've not been there lately. So they expanded their resources for parents. So there's a Caring for Children resource center for parents that includes Help Children Learn at Home, Help Stop the Spread of COVID in Children, and it also includes a new web page with important information about MIS-C. So again, this multi-system inflammatory syndrome in children that's thought to be associated with COVID-19. So it's a condition which, different body parts can become inflamed, including heart, lungs, kidneys, brain, skin, eyes, or GI organs. It can be serious and deadly. Causes are unknown. Some of the children who have it have had COVID, but some have not. Parents should contact their child health care provider right away if the child shows symptoms of MIS-C, such as fever, abdominal pain, vomiting, diarrhea, neck pain, rash, bloodshot eyes, or feeling extra tired. There is also new information from CDC on COVID-19 in newborns. So CDC made available evaluation and management consideration for neonates at risk for COVID-19 to inform healthcare providers how to diagnose, evaluate, care for, and prevent infections in newborn babies, so 28 days or younger, with confirmed or suspected COVID-19 or with exposure, including those born to mothers with confirmed or suspected COVID-19. So, or if you're an OBGYN, or if you are pregnant or planning to become pregnant, you may want to review those guidance documents. CDC also posted a new guidance document on investigation and contact tracing. It is a lovely read if you have insomnia at night. It's some like 52 pages. So this is to provide additional guidance to health departments on contact tracing and case investigation. And it has some recommendations in here that currently, or to date, the Mobile County Health Department has not been doing, but we are going to begin doing next week. Most notable among those is encouraging testing for all contacts of COVID-19 PCR positive patients. So previously, we had been advising that close contacts, so household contacts, intimate partners, anyone that you were around for within 6 feet for 15 minutes or longer, we were telling those people to stay at home and monitor themselves for symptoms. CDC is now recommending that all close contacts get tested for COVID. What we're trying to figure out right now is the timeline for when to advise people to get tested. So we don't want you to get tested too early after exposure because it could be a false negative test. But we don't want you to wait too long that you might be asymptomatic and spreading virus around. So we're working on coming up with some guidelines, and we hope to expect to implement that starting Monday. Again, that coming out of guidance from the Centers for Disease Control. There's also new CDC guidance on what construction workers need to know about COVID-19. So things like notify your supervisor and stay at home if you have symptoms. Let's see, let your supervisor know if you are well but you have a family member who's homesick. Limit close contact, by 6 feet when possible. Wear a covering. Clean and disinfect surfaces frequently, including at the beginning and the end of every shift to protect anyone who might use your vehicles, tools, or workstations. Limit tool sharing. Wash your hands frequently. These kinds of things. There's also new laboratory resources on the CDC website, and then something I would never have thought about as a side effect of COVID-19, that the CDC has also published rodent control recommendation in response to reports of rodents searching for new sources of food while restaurants are closed due to COVID-19. So since a lot of trash is not piling up in the dumpster and around the dumpster and in the backs of restaurants, rodents are having a difficult time finding their next meal and may be invading spaces where they had not previously invaded. So it says residents and business owners should eliminate conditions that may attract and support rodent presence. Tactics include sealing access into homes and businesses, removing debris and heavy vegetation, keeping garbage in tightly covered bins, and removing pet and bird food from yard. That latter one is something that our rodent inspectors see all the time, where they have a rodent problem and they have left a bowl of food for Fido outside all day, and there is evidence that rodents have been feeding from those companion animal feeders as well, or under bird feeders where there's a lot of seeds that get kicked out by birds. There's important information about if a rodent infestation occurs, and then there's also environmental health programs, instructions or considerations that they should continue rodent monitoring and control activities. So again, we have a rodent control service through the Mobile County Health Department that you can contact us and we can help you with inspection and control of rodents. All right, on to some questions. Don't have many today. Not from Facebook, have a bunch from the media since I didn't answer them yesterday. So let's first answer the Facebook question. What is being done to help nursing homes? COVID is rampant there. I'm so concerned for my mother. Yes, we are concerned for people living and working in nursing homes and other long-term care facilities as well, because these are congregate settings where people work very close and they house some of our most vulnerable community members. We have been consulting with all 37 long-term care facilities in Mobile County for many months now. Well, started in March, April, May, I can say many months now, certainly 8 weeks or more, to talk with them through infection control guidelines, use of PPE, how to conserve staff when you have shortages, cohorting and isolating, all of these things, providing them with personal protective equipment, helping them get access to COVID testing. So we have been working really closely with them. One of the things that we are planning to start very soon, perhaps even this weekend, is to offer free testing for all long-term care facility employees. We believe this is an important component of surveillance and prevention to try to keep COVID out of those facilities that currently have none that they know of. And we know that it's moving among facilities through healthcare workers, because there has been, a shutdown on visitation and a shutdown on movement of residents for some time now, since mid-March. So healthcare workers are the likely source of transmission, or at least introduction, now. Before, it could have been anybody who was coming into that facility, but now it's limited. So we are planning, working through our plan to offer free testing to any long-term care facility employee, so that they can try to keep COVID out of their facility. With rampant spread of the virus in nursing homes, what is being done to stop this? So again, we work with them to say, okay, if you have a COVID positive, we need to isolate them, move them to a separate part of your facility, away from your clean units if you can. Those are the kinds of things that we do when we investigate new cases of COVID at a long-term care facility. And several of the facilities now are finally getting to a point to where they have patients who are testing negative, doing the 2 tests negative to demonstrate that they don't have COVID, and they're able to move those patients into areas of their facility that are now clean. So that's really optimistic to see that in some of the facilities we are seeing a turn for the better. Let's see. There's a Facebook comment about use hand sanitizer or wash your hands each time you touch a face covering. People constantly touch their mask without following this direction. Is this going to be a problem with contamination, especially with fast food workers? Yeah, you really should try to keep your hands out of your face, but you got to put your hands in your face to get your face covering on. And yes, certainly people are always sort of adjusting it to get it, further up on their nose or under their glasses, so their glasses don't fog up. And, I'm touching the outer surface of mine now. So, remember that this is not like an N95. I'm wearing this to protect me from spreading my germs to, people who are within my sphere. So I do still recommend that you not touch your face, and frequently wash your hands, particularly after you're handling a mask, and wash it. Sort of, it's kind of counterintuitive if you don't wash it at the end of every day. So yes, try to keep your hands out of your face to the extent possible. If you do touch your mask, then wash your hands or sanitize before you touch other things. So here are the media questions. A statement about the importance of wearing masks in public. So again, let me just remind that the proper wearing of a face covering, if it goes around your ears, the top needs to go over your nose. If it has a metal strip in there, make sure it fits over your nose, and then the bottom part under your chin. All right, so it needs to cover from the bridge of your nose to under your chin. This does not work. This does not protect your family from you, right? This does not work. It has to go over so that it keeps, the droplets from your nose and your mouth from getting, from spreading in the air as far as they would if you weren't wearing the mask. So that's the purpose. The masks that are worn by healthcare are meant to protect healthcare from the patients, right? This we do to protect others from us. Healthcare workers wear N95s and other masks, face masks, surgical masks, to protect them from the patients. So that's the difference. Someone asking what the average turnaround time for a corona test is and how much that varies lab to lab. I've done this analysis and I'm going to try to remember, but I'll probably forget. In the early days, in the early weeks of the outbreak, the worst week that we've seen, which was the week of April 5th, the average test result took 22 days from specimen collection to receipt. So that's the average. The range was 0 to 54 days. Now there's a lot of variance in that, so that average, it has a really big standard deviation, but to give you some idea, back then it took anywhere from 0 to 54 days to get a lab result back. In the last 6 weeks, it's gone down every week, so down to like 4 days on average and 2 days on average, and now we're down to 1 day on average. But that's considering all laboratories. We know that individual laboratories sometimes experience delays in supply chain and equipment validation that makes it more difficult for them to turn tests around in a timely manner. For example, at the State Health Department Bureau of Clinical Laboratories, they do amazing work and they have a high capacity, but every once in a while, if they're not able to get the reagents that they need, or if they have a machine that goes out of compliance with validation or goes down for a day or two, they experience delays. And I haven't checked on their website lately, but they had posted on there that it's taking them more than the desired 72 hours to get test results turned around. So that is not reportable to us, but just to give you some idea, that's what we've been seeing. Testing in Mobile, is it the newer, friendlier swab test, or are any of the old-fashioned stick in the back of the head test? So there's both going on. Some people are still pulling the swab in the back of the head test. That's the nasopharyngeal swab. I used to have one down here. So some people are still doing that, where you take this swab and go through the nose and all the way to the back into the nasopharynx to get your specimen and then back. And then some people have have started using just the swab and swabbing in the nose in both nostrils. That's also something that's allowed now. So so both are going on, and I don't know which labs are doing which. I'm sure that will come in tomorrow's media question, but you can always call them and ask them yourself. Let's see. Here's a story about some guy in a holding cell by himself, 8 hours at the jail, wearing a mask. I'm going to have to read this one off air and see what the intent of that is. Okay. Seems to be different opinions and the reason behind spiking cases. Some are saying more testing, but the health department is attributing it to reopening. Why the difference in opinion? Well, maybe because I have the data on testing for all laboratories. So there are about 80 unique laboratories that report results on patients from Mobile residents. So it's not just one or two of our local really big labs that are reporting lab results. There are at least 80 in Mobile County that are reporting data on Mobile County residents alone. And when I look at all of that data, then you can see that the number of tests performed each week is going up, but the number of positive is not going up proportionately. And I believe other local labs that we partner with and we are so grateful for, I believe that they are seeing the same thing in their data as well. So I'm not sure who is not on that page, but again, it's not more testing that's driving the increase in positives. All right, percent positive of Mobile is around 10%, but if you look just at the last 14 days, the number drops to 6%. Does that show testing is increasing and less people are coming back with the virus? Yes. So as our number of tests increase and the numerator stays about the same, you're going to see a decrease in the percent. What are the ranges of how long it takes to get a result back? I already said that. On average, they're coming back within a day. So there's a comment here that some people are waiting for results that have been waiting for nearly 5 days. Often the negative test result report is delayed. When I'm talking about the return on the result, most of that is coming from looking at the positives. So, many places prioritize phoning in the positive lab results to the patients and sometimes are delayed in getting the negative test results out. That might be a reason why. It also depends on where the specimen is tested. Some local laboratories here, you can drop off the specimen at the end of the day and they test it the next day. Some you have to ship to, a clinic or a laboratory elsewhere in the United States, and so that causes a delay as well. So there are multiple reasons for that. Here is a question about, is anybody at the health department concerned over a lack of enforcement of social distancing by law enforcement? I can't imagine what an overwhelming mission this must be. I feel for the folks that are tasked with policing social distancing. It's got to be infinitely more taxing and difficult as enforcing something like not using your cell phone when you're not texting and driving. So it's an incredibly difficult task. So says there's an understanding among public health officials. Oh yeah, so yes, we get it. We know it's hard. Another question, what does it say that at a time when schools are closed and office buildings in downtown Mobile are empty while people practice social distancing from their workplaces, but beaches and entertainment venues are jam-packed with people who are not yeah, so it is a little disappointing that despite the state public health order and the instructions and our strong recommendations to wear face coverings, that people don't seem to be heeding that. I get it that they may be more likely to comply while they're at work because their workplace may be, making that mandatory for them. And then when they get in the car, their mask comes off and that's where it stays the whole weekend. It's a little bit risky, in my opinion, for people who are 50 or older or people who have underlying medical conditions to do this. But again, we try to plead to everyone's sensibility to try to do your part, take on your personal responsibility for helping us keep the community safe by adhering to the amended Safer at Home order, and please, wearing your face covering when you're in public, and maintaining that 6-foot physical distance, staying at home when you're sick, using hand hygiene and cough etiquette, and all of those things that we've been saying now since early March. So please, again, stay safe out there. Be well. We'll have another report for you tomorrow at 2:30. Thank you.